Most people believe a heart attack always announces itself. Crushing chest pain, a numb left arm, a sudden collapse. That's the image we've all seen in movies and television. But the reality is very different, especially after the age of 60. The most dangerous heart attacks are often the silent ones. They don't always come with dramatic warning signs. Instead, they develop quietly while you're asleep, giving you little or no time to react. And what surprises many of my patients is that these nighttime emergencies are often linked to simple habits they repeated just a few hours before going to bed. I'm Dr. Ethan Cole, senior health physician with over 15 years of clinical experience. And during my career, I've treated thousands of patients with heart disease. One lesson has become painfully clear. Many late-night cardiac emergencies could have been prevented if people had understood how their evening routine affects their heart. In today's video, I'll reveal 5 common nighttime habits that may silently increase your risk of a heart attack while you sleep. More importantly, I'll show you practical, science-backed changes you can start making tonight to better protect your heart. So stay with me until the very end, because one of these habits may already be part of your daily routine, and fixing it could make a life-changing difference. Here's something many people never realize. Your heart doesn't simply rest when you fall asleep. In fact, your cardiovascular system continues working around the clock. During healthy sleep, your blood pressure naturally drops, your heart rate slows, and your blood vessels relax. This overnight recovery process allows your heart to repair itself and prepare for the next day. But after the age of 60, those natural protective mechanisms begin to weaken. Blood vessels gradually become less flexible. Blood pressure is more difficult to regulate. Hormonal changes reduce your body's ability to recover efficiently during sleep. As a result, your heart becomes far more vulnerable during the quiet hours of the night. Think of your heart like the engine of a car. During the day, it's supported by several backup systems that help it adapt to stress. But at night, many of those support systems slow down. If something goes wrong while you're sleeping, your heart has much less room for error. This is one of the reasons why doctors see so many heart attacks and strokes occurring between midnight and 6 o'clock in the morning. While you're peacefully asleep, your cardiovascular system may actually be facing its greatest challenge of the entire day. The good news is that what happens during those high-risk hours is often influenced by decisions you make before bedtime. The dinner you eat, the medication you take, or forget to take, how hydrated you are, even the environment where you sleep. These seemingly harmless habits can either reduce the strain on your heart or quietly increase your risk throughout the night. Let's begin with the habit I discuss most often with my patients because almost no one suspects it could be affecting their heart. Habit number 1, eating a heavy dinner too late at night. Let me ask you something. What time did you eat dinner yesterday? For many adults over 60, the answer is somewhere between 8 and 10 o'clock at night. A large serving of rice, pasta, fried food, or red meat, followed by sitting on the couch for a while before heading straight to bed. It feels completely normal because it's been part of their routine for years. But inside the body, something very different is happening. Every large meal requires a tremendous amount of blood flow for digestion. Your stomach and intestines immediately begin demanding more oxygen and nutrients, forcing your heart to pump harder to meet those needs. Blood pressure rises. Blood sugar increases. Triglyceride levels climb over the next several hours. Normally, that's manageable during the daytime when you're active. But when you lie down shortly afterward, your body receives 2 completely opposite instructions at the same time. One system is trying to digest a heavy meal, while another is attempting to slow everything down for deep, restorative sleep. For an aging cardiovascular system, that's a difficult balancing act. Instead of entering recovery mode, your heart continues working overtime long after you've fallen asleep. In people with high blood pressure, diabetes, or narrowed arteries, that extra workload can become the trigger for serious cardiovascular problems during the night. And that's only the beginning. The next habit is even more dangerous because millions of adults over 60 unknowingly do it every single day, and many never realize the risk until it's too late. Habit number 2, taking your blood pressure medication at the wrong time, or skipping it altogether. If you're over 60 and living with high blood pressure, this next point could be one of the most important things you'll hear today. Many people assume that as long as they take their medication sometime during the day, they're fully protected. But that's not always true. Blood pressure follows a natural daily rhythm. It usually rises in the morning, remains higher throughout the day, and then gradually drops while you sleep. However, for many older adults, that healthy nighttime drop never happens. In fact, some people experience the exact opposite. Their blood pressure rises while they're sleeping without them ever knowing it. This condition is called nocturnal hypertension, and it's one of the biggest hidden threats to heart health. When blood pressure stays elevated during the night, your arteries remain under constant stress instead of getting the rest they need. Over time, this increases the chances of plaque rupturing inside an artery, blood clots forming, and eventually triggering a heart attack or stroke while you're asleep. That's why medication timing can matter just as much as the medication itself. Never change your medication schedule on your own, but it's worth asking your healthcare provider whether your current timing is the best option for you. Sometimes a simple adjustment can provide better protection during the hours when your heart is most vulnerable. Now let's move to another warning sign that millions of people dismiss every single night. Habit number 3, ignoring loud snoring and sleep apnea. Most people think snoring is harmless. Some even joke about it. But from a medical perspective, loud, frequent snoring can sometimes be a warning that your body is repeatedly struggling to breathe while you sleep. This condition is known as sleep apnea. During an episode of sleep apnea, breathing briefly stops over and over again throughout the night. Each pause causes oxygen levels to fall, forcing your brain into emergency mode. Stress hormones are released, your heart rate suddenly increases, and your blood pressure spikes, even though you're still asleep. Imagine putting your heart through that cycle dozens of times every single night, night after night, month after month, year after year. It's no surprise that untreated sleep apnea has been linked to a significantly higher risk of heart attacks, strokes, irregular heart rhythms, and long-term damage to the cardiovascular system. The difficult part is that many people don't even realize they have it. Besides loud snoring, warning signs may include waking up exhausted despite sleeping all night, morning headaches, waking with a dry mouth, frequent nighttime bathroom trips, or someone telling you that you stop breathing while sleeping. If any of those sound familiar, don't ignore them. Speak with your healthcare provider about whether a sleep evaluation is appropriate for you. Now let's talk about another habit that seems healthy, but can actually create unexpected problems. Habit number 4, going to bed dehydrated. Many adults intentionally stop drinking water in the evening because they don't want to wake up during the night to use the bathroom. It's understandable, but reducing fluids too much before bedtime may leave your body mildly dehydrated for several hours. When you're dehydrated, your blood becomes more concentrated and doesn't flow as easily through your blood vessels. Combined with slower circulation during sleep, this can place additional strain on an aging cardiovascular system, especially in people who already have narrowed arteries or heart disease. Fortunately, the solution is simple. Instead of avoiding fluids completely, try staying well hydrated throughout the day and, if appropriate for your medical condition, have a moderate glass of water before bed. If you have heart failure, kidney disease, or have been told to restrict fluids, always follow your healthcare provider's advice. Finally, let's look at one of the easiest changes you can make tonight. Habit number 5. Sleeping in a bedroom that's too hot or too cold. Your heart works best when your body doesn't have to struggle to regulate its temperature. A bedroom that's excessively warm can keep your heart rate elevated, increase sweating, contribute to dehydration, and reduce the amount of deep, restorative sleep your body receives. On the other hand, an overly cold room can cause blood vessels to tighten, increasing blood pressure and forcing your heart to work harder throughout the night. For most people, a cool, comfortable sleeping environment supports better rest and helps reduce unnecessary cardiovascular strain. When you put all 5 of these habits together, they create something much more powerful than a checklist. They become a simple evening routine that gives your heart the best chance to recover while you sleep. Eat dinner earlier. Take your medications exactly as prescribed. Don't ignore persistent snoring. Stay properly hydrated and create a comfortable sleep environment. None of these changes are complicated, but together they can make a meaningful difference over time. If you found this information helpful, take a moment to share this video with someone you care about. One conversation today could help protect someone's heart tomorrow. And if you enjoy practical, evidence-based health advice designed especially for adults over 60, be sure to subscribe and turn on notifications. Every week, I share simple strategies that can help you stay healthier, stronger, and more independent for years to come. I'm Dr. Ethan Cole. Thank you for watching, take good care of yourself, and I'll see you in the next video.